so that can come back on.
Ready to start whenever you want. We're recording now.
Great. Brilliant. Thank you very much. Okay, so we are now at item number 9 on the agenda, and I will be handing over to Boyd to talk about our corporate risk register. So over to you, Boyd.
Thanks, Chair. And the paper is presented to the board on risk. It's in line with previous papers, and just for noting that it's first of all some changes. The financial risks 1103 and 1102 have been reviewed, closed and merged into instead of financial efficiencies and financial balance, there is now an overarching finance one, which I'm just looking for the reference number. Coming 1181, financial position. So that's worth noting. In risk 706, it's worth noting that we're looking at the risks around our recruitment and retention, and it's noted that a workforce board will be looked at with some reference to the Safe Staffing Act, which will commence from next year as well. Other risks include Statman and the socioeconomic situation, cyber risk, fire risk, COVID and flu, which is in under 2 sections, 759 and 715. Transformation risk. The risk is a high-level risk in which if we don't manage to support and enable transformation, then there are risks across a range of our other deliverables, including finance. Our culture risk is standing and backlog maintenance, and also engagement service design. And a new one appearing, 1182, the risks that are associated with the ending of the PFI, the financial arrangement for New Craig's Hospital, and that risk will flesh out in a future iteration to give a bit more detail, I hope. So therefore, what I'm saying is that there are a few small changes in the overall risk expression in the paper compared to the last time at board, but these are small changes and no significant changes other than the ones that I have briefly mentioned. I'm therefore happy to take any questions that colleagues may have around our high-level risk paper.
That's great. Thank you, Boyd. Okay, does anybody have any questions or other contributions on this risk paper? Okay, I'm not seeing anybody wanting to come in. Obviously, we've been looking at various risk registers at our different committees as well, so these are well circulated.
Thanks, Chair. Then it's probably worth noting that at our last presentation of the risk paper, it was picked up outside of board by external parties, and I think it's just key to stress that risk is about things that haven't happened as more than anything else. It's about the actions you take to prevent things happening which haven't happened. I think the interpretation of colleagues who represent information into the public domain, that they were assuming that the risk list referenced in totality immediate crises and immediate issues, whereas the risk paper and the risk register is looking to capture actions needed now so that certain things don't happen or don't develop in the future. And I just wanted to make that clear in this board session, given that misunderstanding that occurred from our people listening in to our board meeting last time.
Thanks, Boyd. I think that's that's a really helpful definition and reminder. And I suppose where I can see where that would be confusing or misinterpreted, particularly when perhaps some of the risks that we have identified might feel very close to things that are happening in reality as well, and there'll be kind of different degrees of that, which are some happening now, some are risks for the future that we're working to mitigate. So thank you for explaining that. That's really helpful. Okay, any questions or contributions for Boyd on the risk paper? Sorry, my screen's frozen. No, okay, I'm not seeing anybody wanting to come in. So just to remind everybody here, we are being asked to note what's in the paper and take substantial assurance in that approach. Are we happy to do that? Okay, great. I'm sorry, my screen's gone a bit funny, so I'm only seeing half of you. Hang on just a second. Okay. Oh, that's made it worse. Okay, so perfect. I will move us on then to item number 10. So this is our Blueprint for Good Governance Improvement Plan and an update on where we are with that. So I'm just going to say a little bit and then I'm going to hand over to Ruth to kind of talk about the nuts and bolts of this. This in a lot of ways is a really exciting thing for us to do. We were a pathfinder for this piece of work, which is now moving to roll out nationally for other boards to use. But I think it was quite an exciting opportunity for us as a board to be a part of. And I just wanted to say before we kind of move on, thank you, a big thank you to everybody who's worked on this. It's obviously really important for us. It follows on from work that we had done previously around improving our governance, and this is kind of the next evolution of that. But there's a lot of work has gone into this. Not all of it will be immediately obvious. There's been a lot of stuff going on in the background to bring us to this point. And in particular, I'd like to say thank you to my predecessor, Boyd. He did a huge amount of work on this, and of course we were supported by Nina Mahal to go through the process as well. And I think having their leadership and their support around this piece of work was really key. And of course, thank you to all the teams internally, you know, not just EDG, but Ruth and her team and OD, they did a huge amount of work on this as well. And what we're going to see today is kind of the fruits of all of those various labours, but of course there is much more work for us to do going forward. So I'll hand over to Ruth. Ruth can kind of explain the technicalities of it. Thanks, Ruth.
Thank you, Sarah. So while you mentioned that there's been an awful lot of work going on in the background and up to this point, this is the start and not the end of the process, effectively. So yes, we participated in the Scottish Government's Pathfinder, which meant that we went through the survey and we did a self-assessment and we held several board development sessions, and the report sets out all of that activity that's taken place over the last 6 months. And it's cumulated with a high-level improvement plan, and which is here for you today for your approval. So there are several improvement themes that have arisen throughout our discussions over the last few months, and they cover performance, finance and best value, risk, culture, quality, board member development, our reporting format development and engagement. And since the last board meeting, we've held discussions with all of our lead executives and our chairs of our governance committees to develop and refine that improvement plan to identify the specific improvement actions. So as per your previous agreement, there will be twice yearly reporting to the board on progress against the agreed improvement plan, assuming that you agree what's in front of you today. And that there will also be some informal and ad hoc oversight of the plan through the governance committees and through the chairs group. And that's something that we will now need to work out, and how that actually fits into the schedule that we've got between now and 6 months' time. So we're recommending a substantial level of assurance on the plan itself. on the grounds that this reflects a thorough self-assessment against the blueprint, and there's been significant engagement on the findings of our self-assessment survey and the delivery of the improvement actions that have been proposed. Future board reports will, of course, reflect assurance against delivery of that plan. So the plan is separate, it's a separate document, it's an Excel spreadsheet, and you're invited to take substantial assurance from it and invited to approve the plan, noting that implementation and progress will be informally overseen by the Chairs Group and through the governance committees, and note that another formal progress report will be submitted to the board in January 2024.
Thank you, Ruth. Thank you, Ruth. So obviously we've discussed this in various other forums as chairs and members of committees and how we want this to develop, but I'm happy if anybody wants to add anything to what Ruth has said or ask any questions, get any clarification before we move ahead. No, okay. So just to recap there, as Ruth said, what we are asking from you all today is to agree this plan and to take substantial assurance, and picking up what Ruth said, it's substantial assurance that we've been through a thorough process to produce this plan and that the plan is good. And then when we bring it back in the future, we'll be talking about assurance against delivery of that plan, just to clarify the difference there. So everybody happy to do that? Great, thank you very much. Okay, and moving on now to item number 11. So again, I'll just open and then I'll hand over to Ruth. So this is our governance committee memberships. Obviously we have had a few changes with myself moving into a different role, and we have lost another board member when Jean finished up. So that left us with a few gaps and a few kind of things that we needed to move around to make sure that we've got the right people on the right committees. So Ruth, I'll hand over to you just to talk about the detail.
Thank you, Sarah. So yeah, just a sweep up. There are 3 particular groups that we're filling vacancies on. That's Argyll and Bute IGB, the Endowment Funds Committee, and the Pharmacy Practices Committee. And the proposals are contained within the report, with the individuals identified within the report. And the effects are, pardon me, you're asked to agree the changes with immediate effect. Do you want me to list the individuals who are, I think you can see them in the report. I think the report is fairly self-explanatory.
Sorry, my laptop's not very happy after lunch and wouldn't let me press the button. Philip, you wanted to come in.
Yeah, it's just to highlight an issue which occurred with regards to the Endowment Funds Committee. I'm chair of the committee, and in the last few weeks I've been on leave. There was a requirement for a meeting in between the diaried meetings, and it was of relevance that there wasn't a vice chair for that committee. I just wondered if that's something that the board needed to consider, whether that was an appropriate position to have as well, just to take care of any issues where the chair is unavailable.
Ruth?
Yeah, I'm happy to look into that for you, Philip. I need to refer to the constitution of the endowment trustees. In principle, I don't see why not. But yes, it was a rather tricky business in the fact that we didn't have a few key members of the committee, and of course we had one of our non-executives who had recently left the board. But I'll certainly look into that for you and get back to you.
Thank you, Ruth. And just one point to pick out, just for clarity, is that obviously members who sit on our Argyll and Bute IGB then also sit on committees of the IGB, but that is not for us to decide which IGB members sit on which IGB committees. So that's why when you look at that very last table there, where it's got the 4 of us that sit on the IJB, it looks a little bit empty at the moment, but that's because it'll go through the IJB and they will decide which of our members will sit on which of their committees. So that's delegated to them for them to decide. And just also, I mean, it's not in the paper, but just to let people know that we are going through the process for recruiting additional non-executive directors as well. And I know that it's one of those things which takes a little bit longer than you'd think it would, but that is something that I have been working on, and there should be news of that very soon, going out to recruit. So I'm happy if anybody's got any questions or comments on that. No. Okie dokie. So we're being asked to agree those changes and to take substantial assurance from that. Are we all okay with that? Great. Okay, right. Now we are moving on to the various assurance reports from our different governance committees. We've got a couple of people off, but I think we're sorted out for people to substitute for them. So first of all, we have got a couple of audit committee minutes in our pack to have a look at. So we've got 2. I'm going to ask Susan if she will speak to both of them, if that's all right. So we've got the minute of the 20th of June and the minute of the 27th of June, because we really like audit committees at the moment. So Susan can say a little bit about what we've been doing in that committee.
Thank you, Chair. And we've also had another audit committee yesterday morning. So there've been 3 audit committee meetings since this board last met, and primarily driven by the need to get our annual accounts and annual reports submitted, approved and submitted. So that's been the main piece of work, and to receive our internal audit and our external audit reports, and to review the recommendations and the progress in signing off those recommendations that has gone on. So those were the main activities that those meetings have been scheduled in order to meet the other requirements we have to get things submitted by a certain time. There was one point in the meeting that we had yesterday when we looked at the minutes of the meeting of the 27th of June. There was a discussion about those minutes, and it was agreed that we would make a small change to the minutes of the 27th of June, as they referenced the internal audit annual report, because there was it was an inadvertent impact of a verbatim reporting of a comment, rather than the full sense of what was intended to be delivered. So the 3rd bullet point, where internal audit was talking about the actual assurance level they had given us, it says in these minutes that it would be brought down to. That wasn't the intention to show that we were being, demoted in some way. So the agreement now is that will be a completely factual statement. It will say the assurance level is limited, rather than include those words brought down, which, while they might have been spoken in the meeting, didn't reflect the true intention of our internal auditor at that point. But other than that, that makes no difference to the substance of the minutes. They still report the same outcomes. And at our meeting we had yesterday morning, which we don't have minutes on yet, was simply to recommend that the reports be brought forward to the full board for their approval. So that was completed on time. So thank you very much.
Thanks, Susan. Okie dokie. Any questions or anything that people would like to add with regards to the audit committee? All 3 of the meetings? No. Okay, right, that takes us on to clinical governance. So we've got a draft minute in front of us from the 22nd of June. We don't have Alistair with us, but I believe that Anne, you can maybe speak to this one.
Well, I don't have a great deal to add on Alistair's behalf. Members will note that the 2 items that the committee wanted to flag for the board's attention were the extensive item we had on dentistry, and also the update that we received as part of the acute report to the committee on the oncology situation. I think that board members have been fully updated since then on how the oncology situation has been resolved and the various mitigations that have been put in place in relation to that. So unless anybody has a further update on dental services, which of course are currently very much waiting for the renewal of a national contract to move forward, I don't think there's anything to add, Sarah. Thanks.
Thank you, Anne. I do have a question actually that I'd like to pick up with regards to that national dental situation that you described. And I see that Boyd's got his hand up, and he'll be able to answer this, I'm sure. Does that also cover orthodontic services as well, or is it just kind of front whatever you would call primary dental care? But Boyd's got his hand up anyway, so I'll bring you in, Boyd.
Thanks. Okay. So orthodontics usually is associated with hospital-based services, but is often in the last decade particularly outsourced into dental practitioners who do a certain amount of it, having had some special training. So it's a sort of crossover service between general dental services, but private practitioners who provide that service, working into what's conventionally a hospital-based system. And Highlands has that kind of hybrid approach. So some people needing orthodontics will go into the hospital and have people who work in the hospital all the time do it, and other people will go to, it's usually in an area, one dental practitioner, can be more than one, who will do certain elements of orthodontic practice up to a certain licensing level or capability level, and it requires technical know-how, technical equipment, and experience. So without labouring the detail further, the answer probably is it depends. And it can be any of those several options, depending on the clinical situation and requirement. It's therefore not part of the contract refresh that you've referenced, where there is national work happening led by the Chief Dental Officer and others in Scottish Government who've been negotiating with a group of dental colleagues at national level. That is now of national interest for all the medical directors in Scotland, the dental directors as well, who also have a national meeting, and the chief execs. And so as we speak, that is being pulled together into an information paper, which will be considered in a number of these national fora. And at the same time, we would expect to see at last an announcement about the details of the contract refresh in the autumn. And then we will, by the last few months of this year, be in a better position to understand exactly what the implications of that contract change might be, and what impacts there might be across the country, and also specifically in the Highland and Argyll and Bute, where, of course, the challenges for healthcare delivery in these geographic settings are different to those in urbanised parts of Scotland.
Thanks,
I don't know
Boyd.
if that answered your question, but
well, yeah. It was maybe more complicated than I thought it was going to be, but you did answer the question.
I think for us here, there has to be we need to play into the national discussions, which people like myself and the chief exec are actively doing, and we will also need, as information emerges, to take that information and the sort of modelling of what might happen, so that we can start to prepare for what inevitable changes there will be. The difficulty is in predicting what there will be, but I think it would be reasonable for the board to be at least made aware that we anticipate the public dental service, so that's the dental service, general dental services run by the Health Board, which respond to people who aren't able to access their GDP, their community dentistry. They will. We might anticipate that public dental service will start to come under more pressure as more people find that they need to go down that route for dentistry because it becomes less available through the current routes. However, it's impossible to predict at the moment exactly where we'll land, and what we have to do is take the emerging information and then try to work out what will be needed whenever the picture is a bit more clear.
Okay, thank you, Boyd. Okay, any other questions or comments around clinical governance? Nope. Okay, I'll move us on then to Highland Health and Social Care Committee. We've got a draft minute of the 28th of June in front of us. Jerry, I'll invite you in.
Thank you, Sarah. Yeah, you've got the minute in front of you. Can I just thank Philip for chairing the two committees while I was away getting prepared. Probably a couple of things I just wanted to bring to board's attention. Just to note, the committee were a bit unhappy, although we recognise the extenuating circumstances, that we did not receive a finance report at the committee. And so we had got to the end of that period where we hadn't really had an update. Now, we've subsequently had a really excellent development session where we've been brought up to speed on where we are. But at that point in time, and we recognise where we were at that point in time, so I was asked to bring that to board's attention. The other one I would just mention was dental services. Again, we had an excellent presentation from the Director of Dentistry, probably mirrored the one that went to clinical governance. And I would just say to everyone, the Director of Dentistry achieved that ideal solution of a relatively short paper and a relatively short presentation, which were excellent and answered all the questions. So I really would, the quality of his discussion and presentation was superb. Thank you very much, Sarah.
Thank you, Jerry. Yes, it's certainly concerning to hear about the lack of financial reporting, but it sounds like that's been picked up, and I was at that development session. It was a really good development session and very informative, but obviously what will be critical is what comes to the next committee, so we can obviously keep on top of that and discuss that as and when. Does anybody have any questions or comments on the Health and Social Care Committee minutes or generally for Jerry? No, okay, I will move us on then. So next we have the Staff Governance Committee draft minute of the 28th of June, and this is Anne again. Anne, please.
Thanks, Sarah. I think the only thing that I'd like to draw the board's attention to is the discussion of the Guardian Service annual report, which was a very important discussion item for the committee, and it was in a tale of two parts, I guess. There were some very encouraging news from that report in terms of signs that more of our colleagues are feeling comfortable with speaking up about concerns that they have, and indeed more of those colleagues who do approach the service are willing to enter a resolution process of some sort. So that was very pleasing news. On the other hand, there was also clear evidence that some of our managers still require support to encourage them to have the confidence to enter into early dispute resolution, and to accept the concerns that employees are bringing to them and have the confidence to act on them, because these are not easy issues to solve, and it was clear that a number of our colleagues still require support with that. So good improvement, much still to do, but I think also the pleasing thing about receiving this report and the further information that we still have to come from iMatter and the forthcoming listening and learning survey, and also our whistleblowing reports, is that by the end of the year we should have really strong information alongside our revised employee metrics to triangulate the picture on what progress we are making with our work on culture. So thank you.
Thank you, Anne. Any questions or anybody want to add anything in there for staff governance? No? Okay. So we have next area clinical forum, and that is the draft minute of the 6th of July. I'll invite Katrina in, please.
Thanks, Sarah. We had a very, I think we called it meaty discussion at the meeting 2 weeks ago. Thank you to the board members that attended. That helped add some context to some of the discussion, which was very useful. So thank you to those who helped. Everything was very relevant. Really, we were talking about the Auditor General review, and that allowed us to discuss a bit about the governance structure generally, you know, where reports go when they come out and things like that, which was, I think, very useful to understand. And then linked into that, obviously, cancer performance. Lorraine, as always, gave us lots of useful data and information with regards to that, which was well received. And a super update on the NTC, which we'd received ourselves as a board previously, which was really good. A lot of positive things in there, especially about the distributed leadership model, and I think about the staff empowerment and the colleagues that were working in order to, with the cultural role at their heart, but very positive and well received. So yeah, very good, and we've got lots of future discussion topics out of that meeting, really, of which Boyd and Louise are going to present to us at the next meeting. To help support some of our understanding going forward, which I think will be very, very useful. But yeah, the minute does speak for itself in the main. There's a couple of spelling errors which I've missed when I've been going through it. You always see another thing every time you read it. But other than that, yes, it kind of speaks for itself. But happy to take any questions.
Thanks, Katrina. Anybody want to raise anything? No. Okay, that's fine. So next we have Finance, Resources and Performance Committee of the 7th of July. And I'd like to invite Alex in for this one, please.
Yeah, thanks for that, Sarah. Yeah, a couple of things to note. First of all, and I mentioned it earlier when we were doing the IPQR, but we had a very good presentation by Lorraine Cowie on the progress on the 31 and the 62-day cancer update and all the things that were being done to try to improve the 62-day. And it's certainly on track from what I can see. What she presented there, and they're doing a great job. So we'll keep an eye on that, but it looks like it's moving in the right direction. A couple of other things. We had the digital plan for 23-24, and that was approved by the committee. And we had the environmental sustainability update. That was a little bit concerning because we have a net carbon zero route map, which shows how we're going to get there to meet the Scottish Government's plans, etc. And it's going to cost us an awful lot of money to get there and get that done. There were some discussions around what that was, why that was. There are some external funding that they're trying to find. The progress is good, and they're doing well in terms of the strategic approaches and the Scottish Government's audit themselves of what we're doing in terms of the environment and the sustainability stuff. So that's going well. But there is a risk that this may overtake us a little bit as we move down the track. And that was us.
Thanks, Alex. Any questions or comments for FRP? No? Okay. So next we have the Argyll and Bute IJB minutes of the 31st of May, which feels like a very long time ago. So Graham, I don't know if you want to, I mean, it's maybe a bit of a double act, because I don't think actually, Graham, you'd quite slotted into vice chair then. So between me or Graham, I don't know if either of us got something we want to raise. I don't think I had anything in particular. As I said, it feels like quite a way back now, but Graham, was there anything that you wanted to add?
Really just about the transition arrangements. It's probably worth highlighting that there's a lot of shuffling going on, and that's been referenced earlier on in the reports as well. So we've got a bit of adjusting to do and new learning, but it feels as if the officials there are well well underway, and looking forward to working with them. So hopefully a fuller report next time.
That's great. Thanks, Graham. Anybody got any questions? Obviously it was a while ago, but if anyone's got any questions on the IGB or anything they want to add, we can pick that up. No? Okay, so that brings us to the end of our committee assurance reports. I do have one other AOCB, but I shall pause in case anybody else wants to raise anything. No, okay. So the AOCB that I want to talk about. Oh, sorry, Garrett. On you go, Garrett.
Yeah, I just wondered if anybody knew about I've just seen a report just flashed up about possible concrete issues on 25 NHS Highland hospitals, the rack concrete. Does anybody know anything about that?
Thanks, Garrett. Have we got, oh, Pam's got her hand up. Pam?
Yeah, I actually was going to raise, but Garrett got there first that Alan was probably going to give an update on that, given that's been out in the press. So Alan's got his hand up now. Thanks.
Thanks, Chair. And yeah, and just for an update, just as it said in the publication, where there is a potential that some of our buildings could have the rack concrete method of construction, which, as you'll have seen, has caused quite a bit of concern down in England. England was a wee bit in front of us, so they've had full surveys done. NHS Assure have been leading it for us, and we are now in a position where any building that's potentially got it, like Gareth said, I think it's not 25 hours, 25 areas that could be within it. We will now get a full inspection carried out by the relevant consultants. So at this stage, we have nothing further to report other than potentially we could have it. As it stands, our normal carrying out property maintenance, nothing's been highlighted to us in regards to any defects within our building, so that's always positive. But we'll keep the board informed on what are there. And just another piece of information, just as you would have seen in the press and that, again, the publication in regards to the buildings, and I mentioned NTC about design failures that was mentioned in the press, just to give the board the confidence that that was a point in time with a KSAR review. We weren't aware of the information being put out there. Out of the 22, 21 of them, it was anomalies in paperwork, it wasn't anything. And contrary to some of the things that was said, it didn't delay our opening. Our delay in opening was, as I reported to the board, was due to lack of resource and lack of materials. So just to give you the comfort that that was the rationale. So
that's great. Thank you, Alan. Okay, I'm not seeing any other hands up. So the AOCB that I was going to raise, but kind of a little bit cheeky, I'm going to hand straight over to Pam in a second, is with regards to our annual review. So Pam will fill you in on the details, but it's an important date, an important milestone for us. But Pam will explain a little bit more.
And there'll be board members who are fully familiar with the annual review process as it was pre-COVID. And this is our annual accountability review that's involves a public session. During COVID, these were suspended, and we did do an annual review, but it was only the chair, myself, with the cabinet secretary and the director general, and online. So that this is the national programme of annual reviews starting up again post-COVID and going back to the traditional way of doing these, which is when it's a ministerial review. There is a series of activities that happen throughout the day. Ours is a ministerial review, and that is happening on the 29th of September, and there'll be a lot of communication between now and then in terms of timings and etc. So there is a public session. There is usually an invite for questions to be submitted prior to the actual day, but on the day public members are welcome and may come with questions. Ours is, as I say, a ministerial review, and Sarah will be required to do a piece of work on that day in terms of presenting from a board perspective. There are some in private sessions. There's a session with the Area Clinical Forum. There is a session with the Partnership Forum, and then finally that ends up with an in private session with us in terms of feedback and further questions about some of our maybe more challenging areas. So it's a big event, it's an important event, it'll be well advertised, and of course we are now preparing for that. Not all boards are having ministerial reviews. There's a balance between those that have a minister present and those that won't. However, all boards have to have an in-public annual review following a very prescribed process. So an important milestone for us, not one we've done in a long time. So a lot of precision planning that will need to be put in place. And I'm pleased to say that is all underway, and we will be adequately prepped for it.
Thank you, Pam. Happy if anyone's got any questions, but hopefully that was all self-explanatory, and you'll see that work progressing as we get closer to the 29th of September. Okay, I'm not seeing anybody else with any other business that they wish to raise. So just to confirm, the date and time of our next board meeting will be the 26th of September at 9:30. See you there. And just thank you very much, everybody, for your time today. Have a good afternoon.
Thank you.
Thanks, Chair. Bye.
Bye, folks.
Thanks, bye.